Ehlers-Danlos syndromes are a group of genetic connective tissue disorders. Symptoms may include loose joints, joint pain, stretchy velvety skin, and abnormal scar formation. These can be noticed at birth or in early childhood. Complications may include aortic dissection, joint dislocations, scoliosis, chronic pain, or early osteoarthritis. Ehlers occurs due to variations of more than 19 genes that are present at birth. The specific gene affected determines the type of Ehlers. Some cases result from a new variation occurring during early development, while others are inherited in an autosomal dominant or recessive manner. Typically, these variations result in defects in the structure or processing of the protein collagen. Diagnosis is often based on symptoms and confirmed with genetic testing or skin biopsy, but people may initially be misdiagnosed with hypochondriasis, depression, or chronic fatigue syndrome. A large number of signs and symptoms still remain to be identified and linked to Ehlers, and ignorance on the part of physicians is, according to rehabilitation medicine physician Claude Hamonnet, at the origin of therapeutic errors accompanied by the iatrogenic effects of prejudice towards these patients. No cure is known. Thank you for watching. Like and subscribe if you would like to view more of our videos. Have a nice day.